Gentleman yields back. Now recognize the ranking member of the full committee, Mr. Pallone, for his 5-minute opening statement.
Thank you so much. Today, the committee Republicans are holding this hearing on AI technologies in healthcare, but unfortunately, this is happening at the same time that the Trump administration and Health and Human Services Secretary Robert Kennedy Jr. are dismantling the Department of Health and Human Services and waging a war on public health. For 9 months now, the Trump administration and Secretary Kennedy have created chaos in our nation's healthcare system. Last week, it hit a breaking point when the administration fired the director of the Centers for Disease Control and Prevention, and 3 key scientific leaders resigned after refusing to sign off on watered-down and misleading and unscientific recommendations on vaccines. The Trump administration's reckless actions leave the CDC with a critical leadership vacuum as we head into the fall and the flu season. Coupled with the mass layoffs of over 25% of the CDC's workforce, this administration's path of destruction threatens America's health. The CDC must be guided by leaders who govern above politics and remain focused on the agency's core purpose, which is safeguarding and improving the health of our communities, preventing infectious and chronic diseases, and protecting all Americans. And I'd like to submit for the record the powerful resignation letter of Dr. Deskalakis, the former director of the CDC's National Center for Immunization and Respiratory Diseases, which details the widespread deception at HHS over changes to the vaccination schedule. Last week's actions follow the Trump administration's decision to restrict access to COVID-19 vaccines for millions of Americans. This unprecedented action by the FDA means that healthy adults under 64 will no longer be able to receive the COVID vaccine. Americans will die as a result of Secretary Kennedy's actions, and that's why it's well past time for this committee to finally begin demanding answers. In April, we called on Chairman Guthrie to schedule a hearing with Secretary Kennedy, specifically on his illegal layoffs and reorganization. Then in June, I called for Chair Guthrie to join me in conducting a bipartisan investigation of Secretary Kennedy's actions to restrict access to vaccines. I have also called for this committee to examine the administration's devastating cuts to the NIH and the administration's dangerously inadequate response to the growing measles epidemic. These requests have been met with silence. Republicans would rather sit on the sidelines as Kennedy moves ahead with advancing his dangerous pseudoscience agenda. Secretary Kennedy must testify before this committee to answer questions and be held accountable for threatening public health by abusing his authority, propagating disinformation, and politicizing science. It's time that Republicans take these threats seriously and join us in holding Secretary Kennedy accountable. Turning to today's hearing, AI has the potential, if used appropriately, to provide innovative approaches and efficiencies in healthcare. The goal in using these technologies should be to provide better direct patient care and health outcomes. But I'm concerned that the expanded use of AI in healthcare has generated significant risks that we simply cannot ignore. Congress must recognize and address the complex ethical, legal, economic, and social concerns raised by using AI in our healthcare system. Without adequate oversight, these new technologies can lead to devastating consequences for patients. Medical care could be delayed and insurance coverage denied, preventing Americans from getting the care they need to live. There's also the threat of personal health information and data privacy breaches. While AI tools can support healthcare providers, their advice and recommendations should not serve as a substitute for the nuanced judgment of healthcare professionals and should not come at the expense of patient safety. And I'm very concerned about the impact of AI on mental health. The tragic stories of teens interacting with AI chatbots that encourage them to take their own lives is devastating. The speed at which AI technologies have been incorporated into healthcare has so far outpaced the regulation and oversight. That's why it's concerning the Trump administration rescinded a 2023 executive order aiming to strengthen AI governance in high-risk domains and issued a separate executive order to remove barriers and revoke policies that they view as hindering AI innovation. I'm also extremely concerned by the administration's announcement to implement a pilot program in New Jersey and 5 other states that will allow for nonprofit companies to utilize AI to review prior authorization requests for seniors in Medicare. I also believe it's critical that safeguards are in place to protect the privacy and security of patient data. AI cannot function without large quantities of data, and we must ensure that the increased data which AI relies on does not come at the expense of consumers' right to privacy. Again, this is a very important hearing, but we have to think about the consequences of what's going on with AI, which can be positive, but often can be negative without proper regulation. Thank you, Mr. Chairman. I yield back.